Hello, this is Luis from the 80th scientific session of first ever virtual ADA conference. The virtual event has introduced updated pioneering advances in diabetes research, prevention, and care. Here are the top ADA updates. Population-based study by Phil showed minor differences in clinical and cost outcomes between canagliflozin, empagliflozin, and dapagliflozin. Patients using empagliflozin appear more likely to remain persistent to treatment. Tang et al. Presented findings from the ACCORD trial highlighting evident benefits of intensive glycemic and BP control and fenofibrate therapy on cardiovascular autonomic neuropathy in type 2 diabetes patients with high CV risk. Murray showed that SGLT2 inhibitors considerably reduced the risk of heart failure in type 2 diabetes patients and could be useful in treatment of patients with heart failure with reduced ejection fraction. Rory Holman presented findings on the legacy effect of metformin in type 2 diabetes patients. The findings advocated adapting proactive glycemia management approaches rather than using a reactive rescue therapy approach for managing diabetes. Silvio et al. Presented a study of exploratory analysis from DAPA-HF, which showed effect of dapagliflozin on the incidence of diabetes. The study results showed a reduction of new-onset diabetes by 32% with dapagliflozin. Newman discussed about methods to diagnose, avoid, and treat the side effects of statin therapy. Although statin therapies outweigh risks, it is critical to assess individual benefit-to-risk ratio. Patient's preference is also a critical factor. David et al. Presented findings on cardiorenal benefits of SGLT2 inhibitors. They concluded that glucose lowering with SGLT2 inhibitors plays a lesser role in cardiorenal protection and that they need to be approached as ROS blockers. Cannon et al. Presented findings on cardiovascular and renal outcomes for Verte's CV trial. In patients with type 2 diabetes and atherosclerotic CV disease, artegliflozin was shown to be non-inferior versus placebo for MAIN. With this, we conclude our 5-day coverage of the virtual ADA conference. Thank you for staying with us. Have a good day.